Close your eyes and imagine this. It's the middle of the night and you can't fall asleep. You have a really bad pain in your stomach. You decide to go to the hospital and you find out that you have appendicitis. No problem. There's an easy solution. You get surgery and a few hours later, you're on your way. But it doesn't end there. Now you have a bill for $15,000 sitting in your lap because you couldn't afford getting health insurance. Megan Leinhard in 2020 said that only 41% of Americans would be able to cover a $1,000 emergency with savings. I have an interest in economics and policy making. I have done extensive research to address issues like this. Our healthcare system is important to consider because it affects the amount of healthcare, the quality of healthcare, and the cost of insurance for every American. The current private healthcare system allows for millions of people to go uninsured and increases costs for people who have insurance. A universal healthcare system would give every American access to healthcare and decrease the amount people pay for it. I urge you to write a letter and make a phone call to your government representative to demand that they pass universal healthcare legislation. Now let's talk about the problems our country faces from our current system. The United States has millions of people without health insurance. The U.S. Census Bureau in 2018 said that 27.5 million Americans did not have any form of health insurance. Jennifer Tolbert in 2019 said that 45% of uninsured adults said they were uninsured because the cost was too high. And only 3% said that they were uninsured because they had no need for health coverage. If they were to face a major medical emergency, most people wouldn't be able to pay for it. 2 out of every 3 bankruptcies in the U.S. are healthcare related. It is unacceptable that Americans are going through such financial hardship over medical emergencies that are out of their control. Another issue with the current system is that Americans spend more on healthcare than any other developed country. Tanza Loudenbach in 2019 said that Americans per capita spend $10,209 on healthcare per year. Compare this to the UK, which spends $4,246 per capita, and France that spends $4,902 per capita. Both countries run on some form of universal healthcare. In general, private health insurance costs more because of many healthcare companies competing against each other. These companies spend billions of dollars every year in marketing and advertising. Furthermore, the companies run on a goal of profit over anything else, and corporate heads pocket most of the money. A universal healthcare system would solve these issues. The greatest benefit is that everyone is insured. All 27.5 million Americans without healthcare would be covered. Kimberly Amedeo in 2020 said that this creates a healthier workforce, which leads to a decrease in unemployment and a boost to the economy. People will be healthier, happier, and wealthier. Access to early childhood care prevents future social costs like crime, welfare dependency, and health issues. Another benefit is that Americans will be paying less for healthcare. The per capita cost of healthcare will be cut in half. This is due to the government being able to control prices through negotiation and regulation of healthcare companies. There will also be lower administrative costs. For example, Kimberly Amedeo said that the U.S. doctors spend 4 times as much as their Canadian counterparts dealing with health insurance companies. People would no longer be paying money to private health insurance companies. Instead, they would be paying in the form of the increase in tax. However, the increase in tax would be nowhere close to the amount of money saved from not paying for private insurance. In conclusion, transitioning to a universal healthcare system will give 27.5 million more Americans access to healthcare and cut the healthcare costs in half. Please get a hold of your representative and demand they pass pro-universal healthcare legislation. If you do not know who your representative is, use this link to find out. Think back to the appendicitis story. The same surgery would cost $10,000 less in a universal healthcare system. Thank you.